Happy employees are healthy employees, right?
Absolutely. Yeah.
Good morning. It is 10:01 on Friday, February 7th, 2025. Call this meeting of the Wichita County Commissioners Court to order. Let's jump right in. Item number 1, receive update from Amy Fagan, Wichita Falls, Wichita County Public Health District, regarding operations and plans for 2025. Amy, thank you for coming this morning. At the last health district meeting, she had presented on kind of an overview recap of 2024, plans for 2025. There were some big things that happened last year and some big things on the horizon for this year. And I thought, you know what, it'd be good for the Commissioners Court to hear that, and so invited her to do it. And so with that, I'll turn it over to you.
I appreciate that, and I'm sorry you're going to have to hear it all again, but you can be our cheerleader here as we walk through this. So you all know that you fund us. We appreciate that. We appreciate the continued funding. We do a lot of great things for this community, and it's one of the things that I think it's important for us to do a year in review of the things that went well, didn't go well, and looking ahead. So the very first thing I will say is our people make it happen. We've got 106 staff. In the summer that goes up to 110, 111, but we are out, we are working, we are doing public health work in this community, and it's these folks that make all these things happen. So we, of course, have a strategic plan. The easiest takeaway from that is be a great organization, look to the future, make sure we're using technology to advance where we need to be, take care of the community that we are entrusted with, and be great stewards of your dollars that you entrust us with, as well as the citizens. And 50% of our budget is grant funded. And so over the last 4 or 5 years, we've really expanded. So before COVID, we had 82, 85 staff. We've expanded. We've used COVID dollars a little differently than others throughout the state and throughout the nation. And so we've really focused in on our wellness programs and on prevention. And so we have expanded, and we will contract back down as those dollars go away. We're planning for that, and we have been for a long time. So last year I set these objectives, and I wanted to make sure that we were very clear, because it's easy to have strategic goals. It's easy to say, I want to achieve these big ticket items, but what does that really look like for the staff, and what does that look like for me and my accountability to my governmental organizations, both city and county? And so I set departmental objectives. And my first thing is always make sure that we are great stewards of your dollars, make sure that we are updating ordinances. We have an unbelievable amount of laws that we have to follow. We have local ordinances, we have county orders, we have, for certain services, Burke Electra Iowa Park, and sometimes those ordinances look different. We have state law. We also go out into Clay and Archer for certain services. We have HIPAA rules. We have everything from clinical services, laboratory, TCQ, CLIA, all the things. Make sure we're following those, make sure we're updating our local ordinances so we're staying relevant. And then also we've done, I'll get to that a little bit later, improved knowledge and expertise within the department. One of the things that we found was 75% of the staff left during COVID times. And so there were very few of us left who had departmental knowledge, institutional knowledge, historical knowledge of the person who has the goat out on this property, who thinks they're grandfathered in, and all those things. And so my job has really been build that knowledge and expertise back up within the department so that if anything happens, they feel comfortable and confident in enforcing laws and doing their work. And then staff retention and fulfillment and resiliency. And I'll get to that. So, and I'm just going to touch on a few of these goals and objectives that we set and kind of what we were able to accomplish, as well as some of the challenges. And so for strong financial management, I put that first. I feel like we have a strong obligation to our citizens to be able to explain how we use the dollars that we are entrusted with. As I mentioned, 50% of our budget, so we have between, 9.8, 10 million a year now in our budget, and half of that comes from grants. We also have provide Medicare and Medicaid services for our immunizations clinic, and so we do get some dollars back for that. And then the rest of it is city funded, and then you all provide us with things for our vector control, as you know, the chemicals, and then that you fund a nurse position, which we're very thankful for. And then we've also used your dollars for the last, I've been here 26 years, for travel and training. So the educational side of making sure that Samantha's folks have their licenses and things like that. We have when I started, we had 2 grants, and now we have 21. This year, we received a new Alzheimer's disease and related dementia, or ADRD, and that we provide services in 11 counties. We have found that people really, you either know someone directly or indirectly who has been affected by Alzheimer's or a related dementia. And I really think that in the coming years, we are going to see more and more of our community, statewide, nationwide, affected with Alzheimer's disease and related dementias.
What does that grant allow you to do differently?
So we receive $150,000 a year. I've hired a program manager and a part-time health educator. They go out and they provide information to medical professionals. Oftentimes, there's not a lot of resources for those living with dementia. So as a good example, yesterday they went out they coordinated with Beyond Faith Hospice, and they were out at, I can't remember the facility name, but they did what they called Dementia Live. And Dementia Live is a presentation where, if you've seen where they go out with the goggles, where the SO goes out with the goggles so you can see what it's like with drunk driving, kind of the same thing with dementia. They do the same kind of presentation about what it's like to live with dementia and what it's like to live with Alzheimer's disease, because oftentimes people put those two together. And so they give presentations I think they presented to 30 people about what they do, the difference in Alzheimer's and dementia. And so they can also, they're to support caregivers. So they're starting local caregivers groups, because what we're finding is people who are caring for those with Alzheimer's end up not caring for themselves and end up in a worse health situation. And so we just started 4 months ago. And so they're building those relationships and then putting together resources. I have a friend who has a parent living with dementia who is having the hardest time. Who do I go to? I can't have home health. I can't afford it. They can't go into a facility. I don't want to put them there. What do I do? What are the resources? And so their job.
I just went through that too.
Yes, it's so challenging, especially in our, Wichita Falls, people generally kind of know what resources are available here, but we're talking all of the, 10 counties around us. And so if you live out in Archer, there's hardly any, options or alternatives. So the question is, how do they come and engage in our services here, or can they find services in the Metroplex? So our staff are putting together a resource database for those people to find and not be so frustrated with, how do I find transportation, or how do I know how to care for this person? Even things like healthy eating. So they're doing a cooking class, right, where it's easy things that you can prepare, or the state just let us we just asked to purchase armbands. Because one of the things that, if you've seen it, people sometimes will wander, and when they have especially more advanced dementia or Alzheimer's disease, and they'll wander and they'll end up getting hurt. And so you can, they're purchasing bands to scan devices that's registered with the Alzheimer's Association to get that person back home safely. So pretty interesting and timely things.
Thank you.
Yeah. The challenge, we have animal services, which is not necessarily in y'all's purview because we provide services for the city of Wichita Falls, but we do support the SO when they call us out, and we are your local rabies control authority. I did ask for a position last year, an additional position in the city's budget, and I was not successful in that. I am hoping that I will be successful this year, but we need more people. Animals right now, people are dumping animals. We're having more. We've had 3 cruelty cases in the last 6 months, and the last cruelty case that I saw was probably the worst in my 26 years. And I don't know if it's the economy, I don't know if it's the people, I don't know, but we are having more cases and we're writing more citations. We are being more enforcement oriented and using the ordinance in ways to keep people from having animals who've shown that they're not being responsible pet owners. And we've had 2 maulings in the last 2 months, and those are unusual, and to have 2 in such a tight time frame, I think we are kind of heading that way where we can expect that. So I'm hoping to be successful this year in my request. Evaluate and improve services. So I think one of the most challenging things, especially from a governmental entity, is to continuously challenge ourselves to ask hard questions. What services are we providing? Why are we providing them? How do we provide them better? What does the community need? And where are the gaps? And we do SWOT analysis and things like that, but we have to ask those questions. And it's my responsibility to make sure the staff are focused on those questions and implementing the solutions, because sometimes change can be scary. And so part of it is when the staff are identifying those issues, then they are responsible for coming up with solutions, or we'll do it together. So for example, we know that some of our grants are going away. We started a grants committee. We're getting all the staff now are getting grants trained who want to apply for grants. And I neglected to mention Samantha's here with me. I brought her because y'all always have mosquito questions, and she's my mosquito expert. And if somebody asks, how long does an egg raft last, like you did last time, and she can say 3 years. And so she of course is amazing. You want to hand out the bags? We brought some goodies. I didn't know there was metal in there, and I went through the detector and told them there was no metal, but there's measuring tapes. So,
Thank you.
I know, almost got arrested. And so our job is to really
These
figure
will
out.
fall at you?
No, it's a stress ball. You can sit there and squeeze it. It's good for your heart, yes. So one of the things is in growing the department, some of the divisions were kind of skewed, right? So one division had 52 people and one had 9. And so I've done some reorganization within the department. And then as grants change, it's constantly shifting. One person leaves, we're going down, we're going to save that money, one person. And so we just are constantly looking at those options.
So, you added the bike-friendly coordinator.
I did, yes. I'm very excited about that.
And just for y'all's information, that was some of what, when we enacted that additional fee, they were able to use the offset from that to put towards that.
For the school.
Yeah, because
technical?
they
Yes.
switched the money from, they were using for crossing guards, because we're covering part of
Yeah.
that now.
Yeah, that's
We're
been a
able to move
long-term
that.
dream.
So
Mhm.
that was a good deal.
Yeah, I mean, you laid the foundation for so much of that, and I think we are where we are because some of the things you had done, like Circle Trail Tour. I asked the staff the other day, let's do the Circle Trail Tour. No one had any idea what that was other than me. And so I'd asked them to call you, but they're starting that back up. So bike-friendly Wichita Falls coordinator, it's been a long-term dream, and there's a lot of people here who are cyclists. There's a lot of people here who drive, who want to understand how to drive around cyclists or be respectful of cyclists, because our community tries to welcome them in. But that coordinator, she was actually one of my health educators, and we, with those dollars, she was hired into that position. We had a whole panel, and she was hired into that position. I think she's doing great things. She teaches Cycle Smart classes, so we do those for adults and for kids. She's working with all of the local businesses that sell bicycle items to really promote and engage people in safety and in how to access resources. So we have a trail app. So few people know that. You can go on the trail app and see where the parks are, where the restrooms are, where our bike fix-it stations are, where our workout equipment is that we put along the trail with various grants. And so she's really worked hard to get out the word of how to get in those Cycle Smart classes. How her next phase is to educate the public on driving. We've added a lot of bike lanes, but not a lot of education around those bike lanes. And for me personally, I have a hard time knowing if I'm on, what's that street, Taft, and there's bike lane, and am I supposed to turn if there's a cyclist here because I can turn right on red? I don't know. And so am I supposed to wait? And then there's a lot of, we need to do some education around safe driving with bike lanes. And she's doing things like she went out to the academy that teaches kids how to drive to get that as part of their driving hours. So I think that's really neat. She also, this last Hotter in Hell, went out and did, with the Rugrat Rally, bike fix-it. Because what she found was there were lots of kids who came out who hadn't really been on a bike before, their brakes didn't work, their tires were almost flat. And so she not only fixed it, but she worked with the parents to say, hey, this is how you put a chain back on, or this is how you check to see if the tire pressure is right. And so I think that will help. And it certainly got those kids to a better successful event.
Did she recently get her LCI certification?
Yes, that's where the Cycle Smart is an LCI under the umbrella.
Cool.
Yeah, and so our goal is to get to the next level of bike-friendly community designation, but I can't remember which one we're at now, but it's the next level.
Silver.
Thank you. And then improve clinical services. I know how y'all feel when I talk about communicable diseases, and I won't talk about syphilis too much, but I will tell you syphilis and HIV on the rise. And that's not just us, statewide, it's nationwide, but I've never seen it like this, where typically in a year we'd have 3 or 4 HIV cases. I believe this year we've had 9 HIV cases. We just got another one the other day. And syphilis is the same way. So in the past, very, very few congenital syphilis cases where a pregnant mom has syphilis, because that can be transmitted to the baby. But we are making sure we're out in the community. We have staff who go out to the 11 counties who do education. They hand out condoms, they do testing in the field. We've always done those things, but we are really trying to get ahead of our syphilis and HIV rise. And so that has been a very big challenge. We've also had a turnover in the lab. We have a 2-person laboratory, and we're CLIA certified and TCQ certified, and it's really hard to find people who can do that and for the pay. But we have staff now, and they're amazing. So continue to provide services and seek improvement. So just to kind of give you a scope of the amount of work that the staff do. So Samantha and her group, they've done 3,800 inspections in a year's period in 2024. Wichita had over 40,000 encounters, and encounters means it could be, mom comes back in 4 times in a year for benefits or for nutrition education, which is what we're really focused on. We had 188 investigations in disease intervention services, and that's where if someone is diagnosed with a communicable sexually transmitted disease, they'll go knock on the door and they'll say, "Hi, I'm Zoe from the health department and we need to talk." And they'll go through and list all the sexual partners, and then we'll go find those people, because the idea is to stop it where it is before it spreads so badly. And then infectious disease, the epidemiologist investigates. The Texas legislature sets what we have to receive from medical professionals within a certain period of time, and then she investigates those things. We've had a couple of cholera. We've had some unusual expressions of illnesses that she's investigated. And then we also really try to communicate with our physicians and medical professionals to make sure they are reporting to us so that we can work together to keep disease from spreading. And then animal services, 3,000 animals in a year, over 3,000 animals in a year. It's a lot. And then wellness. So I think that's where I want to make sure we're bridging the gap on wellness services. One of the biggest issues the staff tell me they have, we did a SWOT analysis with them last Friday. One of the biggest challenges they have is they offer these fabulous classes and the information's in your bag. People don't come. They don't come. We've got stress reduction classes, and we've even gone from offering traditional diabetes education classes, which are 2 or 3 hours at a time, for 6 weeks at a time, to down to 1-hour classes so that you're in, you're out, it's easy. We've tried daytime, we've tried nighttime. And then we've tried to focus in on those things that we hear from people really matter, and that is stress reduction. Lots of us are stressed, henceforth the stress balls. But there's things that you can do to reduce or relieve your stress that will help with heart health and all the different things. And then we offer healthy cooking classes, and we get 1 or 2 participants. And so we have some work to do on how we're communicating to the public to make sure we're trying to get people in seats. But we've changed how we're doing it, and we're really trying to make sure we are as best as we can to get people engaged. But it's a real challenge. One of the things I'd like for us to work on is offering the county maybe some of these classes directly, coming in if we can work on that. We also started offering CPR classes for city employees. So the dream was to have our bus drivers where they could actually perform CPR if someone needed it on a bus, or someone at the MPEC. And we've moved forward on that, so I'd like to pursue that with the county as well in the future. I think that would be very beneficial. And then we also try to do a lot of outreach. So sometimes it's just linking people to services. We have our Live Well Wichita County website, and that has all of the resources, not just health department resources, but all the resources that we know about. Everything from suicide prevention to where to find a local food pantry is on that website, and they do a lot of outreach to make sure people know about that. So some of this pertains, just to Wichita Falls in terms of like right now body art ordinance. There's only one in City of Wichita Falls because you don't have any of those in the county. but we could certainly get to that place, but there is state law. So our retail food establishment ordinance, y'all heard all about that, and we are really looking at these ordinances and asking, why are we doing this? Is it in the interest of public health and safety? I am not about regulations just for regulation's sake. That is not where I want to be. And so we've really looked at these ordinances with a fresh, clear eye of what do we want to be doing? Why are we doing it? Are we doing it the best way we can? And we've walked back some regulations and then made some more stringent, like people who bring in litters of puppies to us consistently. Y'all have been through this, so you know the food establishment ordinance. We really try to make sure that the public understands. We don't just wake up one day and say, I'm going to change this rule. That is not in my purview. My purview is in to make sure that I'm listening to the citizens, I'm making good recommendations, the governing bodies have what they need to make those decisions, and then this commissioner's court or the municipality body in each of those municipalities makes those decisions. But it needs to be in the right interest and for the right reasons. And I feel like we've transitioned over to doing that and being very, very transparent. That is my number one. Let's make sure people understand that we are being absolutely upfront about what we're doing. And then educate the public about who we are and what we do. So we used to have a health fair before COVID, and we had done it every year, I think, for 15 years. And we were able to bring that back last year. I'm really glad for that. I would like to do a better job coordinating with the county, so maybe y'all can encourage your employees to come out. It features all of our services, but we usually have 30 to 40 community participants as well, and it's just a fun time, and we're trying to do more around engaging kids. And we've moved it, instead of a Saturday, we've moved it to a Thursday so that the participation's a little better. And then I've already mentioned this, but commitment to transparency. So animal services numbers are my example, but in the past it's been, we're not going to talk about how many animals we euthanize or what happens with the outcomes with wildlife or whatever it is. And my thing is, people have to know what the truth is. They have to know what we are dealing with. They have to know how those animals come to us. And we take in more animals through the front of animal services by citizens and return adoptions than we do through animal control. And I never thought that would happen. But I'm going to tell the people what we're dealing with, because there's no sense in not being upfront about it. That's where your tax dollars are going. If you live in the city limits of Wichita Falls, that's where your tax dollars are going. So that's the animals we take in. That's what happens to them. Thankfully, our euthanasia rate has gone from about 70% down to about 30%. I'm very happy for that. So we're doing a lot to get animals out. Our local rescue organizations are amazing, but we're transparent in what we do. No matter what service it is, you'll find it on the website. We will answer any of your questions. We don't cover anything up, but it's really important to me to be transparent.
Y'all started posting that last spring, is that right?
Yes, and we did it kind of in a timed way because I didn't want people to panic on me. But it's to me a gradual approach, because then you reach your saturation point where people are surprised, and then you kind of do your next thing so that people stay engaged. And then spay-neuter campaign. So we have so many animals in this community who are not spayed-neutered, and I understand there's a lot of reasonings for that, but the goal is to get as many animals spayed and neutered as we can so that we have less animal population, because we have too many animals unwanted in this community. Improve knowledge and expertise within the department. I mentioned this at the beginning. We've got a lot of staff. Samantha's folks in her division never see the folks who are in wellness, who never see animal services. But if you've got the logo on, my goal is if somebody sees you at the United and they say, oh, what do you think about this? Or, oh, what do you do about that? I want my people to be able to be knowledgeable, at least on a foundational level, to say, I'm not sure, but call Samantha, she can tell you. And so we've really done a lot of work to get everybody in the same room, talk about our programs and services, and just do a little team building, because these times are challenging and people need each other, in my opinion. We also have an advocate newsletter for the staff, and then we also have one that goes out to the public. And then we've worked on interdepartmental coordination and intra-departmental coordination. City of Wichita Falls, there's a lot of different departments. There's been a lot of changes. There's a lot of different things and moving parts, and so there's always room for improvement in communication, and we've really focused in on that in relationship building. Encourage and embrace change and innovation. I always tell the staff, it's all about the amount of change that they can tolerate. Because if you change too much too fast, people sometimes will not be with you, or they'll panic just a little bit. And so we've really, as we're looking to make those things, we've been very clear and intentional on what changes are happening, what we're keeping the same, so they feel that foundational component is there. But it was time to make some changes. We had a computer system that was super outdated that we took from one system and broke it into two. So her system ended up being great, but the clinical system ended up being terrible.
That's the one we helped fund. So-
Yes.
The great one, yeah.
The great one, not the other one, the great one. Yes, thank you. And we appreciate those extra dollars, and we were able to purchase some Surface Pros for the field. And so the nice part is she's going to get to the point where her staff, they're going to be fully functional in the field. They are now, but we will be able to send all that information to the owner, to the person who's there in front of us. People are going to be able to go in online and pay all of their invoicing and permitting online. We're moving into what century are we in? 21st century. We're moving that way, and it's fabulous. But the clinical side, it's really hard to find an electronic health record that is geared to public health. We're such small potatoes in the world that most are geared towards hospitals and clinical systems. And so the one we have now is not necessarily optimal, so we're reevaluating. I'm not going to commit us to 5 years of awfulness, because that's where we thought we'd be. So I'm always looking to how do we move and make sure it's optimized for right now. And then we try to do a lot to use social media to our advantage. And that means actually saying what it is, being open and transparent, responding to comments. That's always a hard thing for a governmental entity to figure out, where you say the truth and where you just sit back and let things go. That's a hard place to be. I'm sure y'all can understand that, but we try to really navigate it so that people know the truth, especially when there's animals involved. And then our top Facebook posts for the year were our HIV outbreak, where we went viral with over 245,000 views, and that was 2 weeks ago. Don't wash your meat graphic. And we just started that one pretty recently. And Reels, we started using Reels. You got to meet the people where they are, and people like Reels and videos and all those things. And so we try to stay up to date on those. And then we try to use GIS technology. You know, that interactive mosquito map was a big ad for us last year. We're hoping to be able to make improvements to that this year. And then WIC has had some system changes. And then staff retention, I've already mentioned this a couple times. I will say the 2022, we had 28 staff who left the department. In 2023, we had 23. And 24, we had 14. And one of those was a true, HR classifies them as regrettable loss. And so I think that's a big deal. I think keeping people and having them be happy in their work is important. And I think that we've transitioned over into that. I'm very grateful for that, which is part of staff happiness. And I have the best job ever. I think staff happiness is important. It's not my job to make them happy. It's not my job to do any of those things. It's their job to be happy, but it's my job to create an environment where they want to come to work and where they feel supported and cared about, because they have really hard jobs, especially on the enforcement side, because it's like Sonic. I'm just going to use the Sonic on Kemp example. You either close them down too soon and you're a big bad entity, governmental entity, or you close them down too late, and how dare you not close them down sooner. And there's all this in between where, we've gone out, we've talked to them, we've had a compliance plan. Rats happen sometimes. Please don't quote me on that one, but that's the reality of our lives. And so that's a business owner's business. They are making money, and we have to find where we can implement rules and laws and have compliance plans. If it's egregious, we can absolutely shut them down. But that's just one example. We have to find our middle ground. We have to find where our role is. And that's hard. And it's hard for the staff, whether they're an animal control officer or they work in her division as a sanitarian. The enforcement part is hard. And so my job is to make sure they want to come to work, and they have my support, and they have the support of our legal department, and that we're doing things the right way. Frequent and transparent communication, consistent expectations across the department. Sometimes that's hard when you have such a breadth. Y'all know this. You have so many different departments here. I still can't quite keep up, but it's hard. It's hard to have clear and consistent expectations across a diverse organization. And so I think we've really done a good job with that in the last year. And then, surveys. Ask the people what they think. Ask our customers what they think. We've done a lot around customer satisfaction, how we make those improvements and things like that. And then we ask people, to give kudos and celebrate each other, and we recognize months and weeks and all those things. And so we like to do those things, and it's important to people. And then if they want to be recognized on social media or whatever, we do that. But it's important. It's important to us. All right, challenges and advantages. Again, expectations, rules of enforcement, what our role in society is, all of those things. We are constantly and consistently navigating that. The right amount of tolerable change, that's something that I've been really focused on. How much do we change? But then we have to constantly reevaluate and then move to the next step. One day I'm going to be satisfied, but it's not today, and it's hopefully when I retire. And the right amount of accountability, and anyone who is responsible for supervising staff understands this. You've got to hold people accountable, but also understand and help them adjust when mistakes are made. So it's just this constant, and then you have to decide where you can move forward and where you don't want to. And then changes within the city of Wichita Falls. So we all know there's been lots of change. There's been lots of good change. There's been lots of change, but it's a lot to manage. And so I find that both a challenge and an advantage. All right, 2025 goals. Basically, keep all the things that we said we wanted to do, make them better, make sure that we're serving the public, make sure we're asking the public their opinion and making those adjustments as we see them and are able to. Continue to seek improvements. Continue to recognize the good. I'm sure y'all get this all the time, because most of the phone calls that we get are maybe not people saying, y'all did a great job, but it's, y'all didn't do this right, or I'm mad because you took my dog, or I'm mad because you didn't take his dog. And so we have to recognize the good. We have to find those moments where we can recognize those things and move forward as an organization and just continue to serve. I tell the staff all the time, we have to have the heart of a servant and be an educator, because we want to educate first. And then seek ways to improve communication. That's the last staff survey. That was one of the great things and one of the challenges. And I think that's true in any organization. So thank you, because I'm truly grateful for y'all and your support over the years. I think we've got lots of great things to do, and I appreciate your support moving forward.
Y'all have any questions, comments for Amy?
It's pretty thorough.
Okay, thanks for spending your Friday morning, and I do appreciate the opportunity. I always say I need to come to court more and talk about it, but I do appreciate the time. I know it's a lot.
There are a couple things. I would just kind of like to ask, because y'all have seemed to make a concerted effort. This was not unique to Wichita Falls, but the public health sphere coming out of COVID had some challenges in communicating with the public and trust, and y'all have seemed to lean into that and rebuild those relationships, and you talked a lot about communication. I'm guessing that's an intentional decision on y'all's part.
Absolutely.
To lean into that and try to restore that trust.
Absolutely. And, we did things here a little differently than the rest of the state and the rest of the nation. And I think that has served us well, because I think there was still trust for us as an entity. I know there's opinions on all the sides, right? But I think our thing was we did things a little differently. And I've learned a lot about the state and the CDC. And we're just kind of our own entity here. We're a local health department. We have a local health authority, and we can make our decisions as we see fit. And that was something I appreciated about COVID. But absolutely, we have so much that we do that's outside of COVID and vaccinations, and we still need to be talking about measles. There's a measles outbreak right now in Lubbock, and there's 6 kids who were sick, and it's an issue. So my job is still to provide information about vaccines and why they should get standard measles vaccines and things like that. But yes, we started a campaign that was about we're your neighbor. Because the thing is, we all live here too. We all pay taxes here. We all have family here. I've been here forever. I've chosen to stay here. I love it here. And so that was something, we're part of your community, and we do so much that is in support, and we all are servants. That's our role in this community. And so we've done a lot. And then I started a rebuild and repair tour. I mean, I've talked about that. It was important to me to talk to people. I've met with so many people and just said, let's talk about what the issues are. Let's make sure we're transparent in everything that we do. And then if there's ways that we can be more transparent, I've absolutely been open to that. And the staff have been as well. And it served us really well, because the employees want to be open. They want to be, this is what I do, and this is how I can do it better, or this is why I did a great job. And so I found favor in that, so thank you for that.
Yeah. Well, I mean, I think it is bearing fruit, and I'll brag on Samantha a little bit. That a few times where I've needed to elevate something because there was an issue or a perceived issue or whatever, one conversation with her from those folks typically fixes the problem. Either because communication lines are restored, or there's just a realization that this is why y'all are having to do what you're doing, and understanding. So
Yes.
thank you for that.
Absolutely, yeah,
Thank
she's
you.
a star for sure.
Yeah.
Okay.
They're always helpful. Reached out to you this week with a question, and Samantha got me some
Yeah.
information, and I really appreciate it,
Yeah,
so.
absolutely.
Did that attachment come through?
It didn't
Because
the
I
first time.
printed it.
Okay, good. Yeah, thank you. Awesome.
Maybe we're planning sometime through Extension, hopefully late spring. Extension has a pretty extensive water well safety program, and they have a mobile lab to do testing. I get calls from time to time, people want to know, where do I get my water tested? And they're gonna try to bring the portable lab up here for a day where we will be able to advertise if you've got well water and you wanna get it tested, or you're interested in that. It'll be an educational deal. We don't have the details yet, but I'll keep you in the loop.
Great.
And our ag extension agent's working on it. And I ran into the specialist at one of our state soil and water conservation board meetings and talked to him about it, because we've got well water in this part of the country, and I think we'll see more and more of it. And they are in that business and do a good job and come to us. So
Yeah.
I'll keep you posted on
Thank you.
that, but we're trying to put that together for sometime later this year.
Yeah, that's great. Thank you.
One more question.
Yeah.
You know if our indigent health department's gonna be part of your health fair?
I don't know. We have a committee for that, but I will
Okay.
check in with them.
Okay. No,
Because I do think, we've tried over the years to have a really good partnership with Indigent Health.
Yeah, and we're getting out in the public a lot now,
Good.
so.
That's
we're gonna be
great.
part of it.
And we can do classes specific for, if they have folks who are in that program and they want to, Tuesday at noon, we can come teach our stress management class or our healthy cooking class or whatever.
Okay.
We can do those things. Absolutely.
Awesome, thank you.
Okay.
Okay. Amy, thank you very much for your time.
Thank you, Judge. I appreciate y'all.
And y'all feel welcome to go ahead and skedaddle. You've got stuff to do, and
Thank you. Appreciate it.
I'm not kicking you out. I'm just inviting you to do that. if you-
Thank you. I appreciate you. Thank you. Y'all have a good weekend.
You too. Thank you. All right, item number 2 is review and discuss jail maintenance projects and work orders. Chief?
To me, the Square D electrical surge protector project has been completed as of this week. We're still waiting on some drivers to come in for 7 lights that are out throughout the facility. And they should be here starting on the 21st, they should start arriving. So what else was big notes? Vehicle gate rollers, the rollers on the vehicle gates, they're time to replace them. They're wore out. They're about $700 to replace all those rollers. Open and shut a lot.
Yeah.
Yeah.
The next thing talked about, and I did not know we had them, is there is surge, let me see, there's replacement batteries for the emergency lights throughout the building. They have a life expectancy of 5 years. So we're coming up on that 5-year period. And the estimate we have right now is about $52,000 to replace those, their light and surge protector, their extra, their backup battery to the emergency lights before the generator kicks on. So budget for next year, or wait and see when they start going out.
When is 5 years? Oh, sorry.
5 years coming up next, well, technically we've been there 5 years, 2020.
We should get those on an alternate calendar where we're doing.
Mhm.
we
And
should
also
every
they're-
year, like,
There are apparently battery backups for the HVACs too, that is time to start replacing. Which I don't have a price on them yet, but did not know those things existed. So,
Yeah,
I
I know
learn
we've got
something
any
new every
backups
day.
on the HVAC, the exit lighting and all that, emergency lighting. We should probably divide it into quarters and
do so
do
many
a
each
quarter
year.
each, or section each year. That way it's not hitting us all at once.
Yeah.
Yeah, let's have a
Let's have a discussion.
separate
about that.
conversation about
Okay.
that, because that's not a small amount of money for an unbudgeted item.
Yeah.
So let's talk about what that would look like. I think Commissioner Beecham makes a good point on getting on a new schedule, but
Sure. Had we known that,
Right.
we would have been on top of that ahead of time. Trinity will be here the week of the 17th to do the filter changes. So it's time for that. And then I guess they'll be back in April to do the filter change and maintenance. February, March, April, yeah. And that's it on the maintenance.
okay. Any questions for Chief on jail maintenance?
The light drivers, did you get a bunch of extras? Because we're not ever turning lights off in a lot of that. We're gonna start.
I don't know if they bought extras. They had 7 lights out. Looks like they only ordered the 7 drivers. We may have to order a few more and just have them handy.
Yeah, I'll go ahead and
Okay.
get some attic stock built up, because we're gonna start seeing some failures. So we never turn off lights in a lot of areas.
Yeah, and always stay on, but the pods will go out.
Yeah.
But a lot go out, not completely, but yeah.
So they do have a life expectancy as well,
Yeah.
everything else.
Yes, sir.
And we may talk about this in the next item. Did you have a population report for this week for outside?
Yes, I do. I have
Okay,
it.
but that's probably
It was
next
coming
time.
up to the next
Okay, that's
section.
fine. All right. Any other questions? Okay, let's move on to number 3, which is receive status report on salaries and overtime. Elmer sent this out yesterday at 9:13 a.m.
Thank you.
Thank you, sir. Thank you.
I think I made enough for myself. It's okay. Matt was able to put that in a Excel, so it'll be easier to keep track of it. Give you all the reports. So on jail staffing, we are 22 openings. We have 5 that are set to start next week, and we have 5 there in backgrounds that are getting close to completing backgrounds. So,
A long way from single digits.
Killing
Happened
me.
quickly.
give me gray hair. I don't know if y'all know this, but jailers are required to have food handler license. We have to do that when we first hire them.
Really?
Yeah. TDCJ or the jail commission requires food handler license. for jail. When Amy was talking, I made a little note. And we also we've got a plan that we're working on with United Regional to get all our guys recertified CPR, stop the bleed. It's been 4 or 5 years since we've all been through that. So through this year, we'll be working on getting all our guys and jailers certified, recertified.
Chief, just looking at some quick math here, it looks like we're running about 80 inmates all told that aren't our folks.
That's
based on
correct.
these numbers. So we're running about 500 of our folks and then another 80 from outside.
We've started, we're gonna start with the women's side and start moving them around out of their pods they're in. And we got 8 pods vacant, so we're gonna move and refurb the pods, get caught up on paint and anything that needs to be fixed, and start that on the females this next week, and then we're gonna move them, start moving the males out after that. So the next few months will be just touching up all the pods. Overall, the facility, I think, is in great shape, and
What I seen you
it just
today
needs some
was
touch
great.
up here and there.
It's better than other facilities I've been in
Yeah,
that have held inmates, so.
yeah. They're doing a good job keeping it clean. This pay period also had the jail school on it, the last week of the jail school, and of course the shortages.
Chief, is Baylor County on the new interlocal rate?
I believe so, the
The
65,
65
yeah.
one.
And we're probably gonna address that coming up real soon about changing that and raising that to a little bit based on the new calculations from the jail commission on how to figure pricing.
Okay.
Does Baylor County keep any themselves, or we do them all?
They do not have a jail
Okay.
at all.
I was thinking that was the fact, that's why.
We actually have one that, that pled guilty to a crime in Baylor County, which normally they would be housed until they went to TCJ. So we actually have one that is Knox County inmate that's gonna be here on a Baylor County bill.
I'm thinking that for those smaller counties, especially west of here, that's gonna be more and more the trend, isn't it?
I believe we'll start seeing some of a trend that way.
Yeah. And quite understandable, you know, when you look at hiring challenges and, you know, and not just the cost, but
Yeah.
staffing and all that, get tougher and tougher to do all the time.
Are we on the new marshal service?
She's
Okay.
working on it, and of course, once we send it, it's on the freeze anyway. But yeah, she was finishing up some reports for last year, and then she's been started working on it. So, and then once she gets her stuff done, she'll send it over to the auditor's office.
We're still looking through it, or?
I'm done with
And the marshals and Collin County are still looking for more beds, but we don't have space to give them more beds.
Yeah.
So,
it. Time to build new pods.
no.
Well, it also starts to affect our core health contract too, if we
Yeah,
get over 600.
exactly. And
That was a bad
contract.
joke.
Yeah, I know. I know.
Yeah.
Should have built bigger.
Well, we've got it set up where we can, if we need to at some point. Very easily done.
You good? You still looking?
Oh, I'm done.
Mark, are you good? Are you still
good.
looking?
Yeah, I'm good, thank you.
All right, moving along to item number 4, which is review and discuss regular bills. Chief, thank you again for the
You're
numbers. It's helpful. Matt sent this out yesterday at 10:24 p.m. Way to go, Matt. You get paid hourly, right?
I wish. I'm wondering,
Excuse me.
on precinct 4, that VG Young, did he pay all of ours out of his precinct?
No, that is, so Commissioner Watts has been asked to be part of the VG Young Leadership Academy.
Oh, okay.
And the tuition for that is $3,200. And so whenever I spoke with him, we could have the option of paying it all at once, or we could take the option of paying half now and paying half next year. He's going to 4 or 5 conferences between this year and next year. So we took option to pay half this year, pay half next year.
I thought maybe they just stuck all of ours on one deal.
Out of
No,
the
sir.
goodness of his heart.
Yeah, I was like,
We
well, that's
were-
nice
we
of
were-
him to pay for us.
Yeah, we were hoping.
He's not here. Now would be the time to make that
That'd be a
motion.
good
Yeah.
time.
And Mike did have a revision to precinct 4 that he sent this morning, that we added the First Bank, and then a revision to payroll where we added the
I saw that.
United Concordia
Yeah.
bill.
And for Mark and Barry, I wouldn't hesitate much on the getting the rock. There seems to be a little bit of a shortage of it coming up this spring.
How do you run out of rock? Think about that.
The state, well, the state's taking it all. I'll put it
Yeah,
that way.
I understand. There's just something about that that seems, that's a pretty basic material.
So you'll see that general operating is pretty heavy, almost 1.7 million. About 800,000 of that's core health. About another 400,000 is going to be your 2025 budget transfers from general operating to the precincts. And then the rest of that is a lot of attorney fee orders.
Yeah.
A lot of what?
Attorney fee orders.
What's Smoky's Naturals?
A investigator firm for,
Mhm.
I don't know if it's DA or just had it up.
I think there was one maybe that was the judicial non-departmental, and there was 2 or 3 that were for the defendant and that were charged to 656.
I love paying for all the teams.
Pay for everybody. It's what we statutorily do.
Offense, defense, referees, the cheerleaders, the band.
Prosecutor and the field.
Yeah. The only thing we don't even get to take from the concession stand, we have to send that all to Austin, so.
Man, attorney's fees were heavy this time.
Mm-hmm.
Is that a function of 2024 stuff all coming to?
Mm-hmm. And unfortunately, if you clicked a few of those, you'll see that a lot of it is heavy on them sending them to the judge late for, their full 2024 services. Not late, but sending them for the full 2024 services just at the end of the year. There are several of them where they were signed in September, or they're signed in October, and unfortunately, we're just now getting sent those.
Oh,
So,
So,
still go on the 24 ledger, or
yes, sir.
how long do we keep it in the 24
I'm
ledger?
going to keep it one more week. It's 30 to 60 days. So next week would put us right at 45 days. And after that, we'll just start charging everything at 2025.
because y'all will be wanting to wrap up, start on wrapping up 24 soon.
Yes, sir. our goal is to have financial statements out by June, by end of June, with the GFOA award.
Okay. Matt, do you have an idea on when 24 budget amendments from the standpoint of overages in department, when we'll need to start looking
Yes,
at
so
those?
we are processing the payroll end of year accrual, and once we complete that, then Mike will have the amounts for the budget amendments, bring it before the court, get that approved, and we'll have it in either the same day or the following day.
So probably either that 21st or the 24th, 25th February session? Okay.
Yes, sir.
I'm looking at you, Chief.
I don't know why you're looking at me.
Y'all just let me know when you're good to go.
I'm done with
You're
it.
good? You're good, Barry? You're
You
still-
bet.
More
No,
tab.
Okay.
I kept going back through it thinking it'd go down and it didn't.
Oh,
Yeah, yeah. Maybe I just went one more time.
The next two lists should be considerably less. Accounts payable is on their game, and we're pretty much current on every one of our invoices. So, and we've been making an emphasis that if an invoice comes through and it shows past due balance, it's investigated, make sure that the check has been previously sent, or if not, like you've seen on this list, there's 2 direct energies with the same account number. Unfortunately, that's from a July to August bill that was not received and paid. So we got that caught up. So every bill, if it has past due balance, investigated, make sure that we're current. If we're not, then we're getting it and we're paying it.
Yeah. I'll commend y'all on those efforts. I'm part of a lot of those email chains, and my email traffic's gone up significantly, but yeah, it's because y'all are doing your due diligence.
Yes, sir.
You good?
I'm good.
Yeah. Any final questions, thoughts, concerns?
Nope.
Okay. It is 10:58 and court is adjourned.
Awesome.